Welcome to The Explainer. For millions of families, it all starts with this quiet, nagging worry about a loved one's memory, a worry that eventually leads them into a doctor's office, asking the simple question, what's happening? Well, today, we're going to decode that entire process, step by step, to find out what really goes on during a dementia diagnosis. So, to really see how this plays out in the real world, let's follow the story of a patient. We'll call her Mrs. E. Her situation is a very familiar one, a starting point that brings so many people to their doctors searching for answers. And right there, that's when the concern becomes real. This isn't just about forgetting where you put your keys or a name at a party. This is about changes that are starting to affect a person's safety and their ability to live independently. This is the moment a medical worry becomes a real-life problem. Okay, so what's the picture we're getting of Mrs. E? She's 72 years old, and for the last 3 years or so, her memory has been slowly getting worse. We also know she has a history of high blood pressure, and she's had a TIA in the past, which is basically a mini stroke. On top of all that, she gets really anxious when she's left by herself, and importantly, dementia runs in her family. These are all the first puzzle pieces a doctor starts to put together. And that is the big question, isn't it? The one that just hangs in the air. It's filled with so much worry and the need for a straight answer. So what does happen now? How does a doctor even begin to unravel something this complex? Now, before we dive into the nitty-gritty of how the diagnosis is made, it's really, really important to understand why getting it right matters so much. This is about way more than just slapping a label on the problem. Think of it this way. An accurate diagnosis is the key that unlocks everything else. First off, a doctor absolutely has to rule out other conditions that can look just like dementia but are actually treatable, things like a vitamin deficiency or a thyroid issue. Second, just knowing what you're up against helps a family plan for the future. And finally, not all dementias are the same. They require totally different approaches to care, so getting it right from the jump is essential. All right, so how does a doctor start to solve this puzzle? It's not about one single magical test. It's much more like a careful investigation, almost like a detective gathering clues piece by piece to build their case. I think a lot of us imagine this kind of diagnosis comes from some high-tech brain scan. But the truth is, despite all our amazing technology, the foundation of a dementia diagnosis is, well, clinical. It happens right there in the doctor's office, relying on the physician's skill to piece together a history, conduct an exam, and assess a person's thinking. This whole evaluation follows a pretty clear roadmap. There are 6 core steps. It all kicks off with hearing the patient's story, but then, just as important, is hearing from the family or caregiver. After that comes a physical exam, some quick cognitive tests, some basic blood work, and then, only in some cases, a brain scan. It's a really thorough process. And I want to pause on that family interview, because it's not just a good idea, it's considered obligatory. And here's why. A lot of the time, the person who's actually experiencing the changes doesn't really have insight into them. They might not notice their personality has shifted or that they're struggling with daily tasks. The family, they provide that crucial outside perspective. To get a more objective look at someone's thinking, doctors use these standardized screening tools. You've probably heard of the most famous one, the Mini Mental State Exam, or MMSE. Another really common one is the clock drawing test. Sounds simple, right? Just draw a clock. But it's an amazing little window into some pretty complex brain functions, like planning and spatial awareness. Each test gives you a different piece of the puzzle. So back to Mrs. E. She scored a 24 out of 30 on her MMSE. Okay, so what does that number actually mean? Well, it confirms that, yes, there is some cognitive impairment going on, but, and this is a huge but, it doesn't tell you why. That score is a vital clue for sure, but it is not the final answer. All right, this next phase is all about detective work. It's about ruling things out. Before a doctor can land on a diagnosis like Alzheimer's, they have to be absolutely positive it's not something else, especially something that might be reversible. And this is exactly why a set of routine lab tests is always part of the workup. Doctors are basically on the hunt for those dementia mimics, things that can cause confusion but aren't actually dementia. Could it be anemia, an underactive thyroid? Is their vitamin B12 level tanked? Any of these can look like dementia, but here's the thing, they're all treatable. So what about brain scans? This is a big one. A lot of us think a scan can just light up and say, yep, it's Alzheimer's. But in a routine diagnosis, that's not really their job. Standard scans like a CT or an MRI are used to rule out other big problems, things like a brain tumor, signs of major strokes, or fluid buildup. They're not there to positively find Alzheimer's. Okay, let's take stock. The doctor has now gathered all this information: the history from the patient and the family, the physical exam, the cognitive test score, the lab results. Now comes the crucial step: putting all of those pieces together to see the whole picture. What the physician is doing is checking to see if the patient's situation fits the official clinical definition of dementia. And it's pretty specific. It means you have to have a memory problem that you weren't born with, plus a problem in at least one other area of thinking, like language or judgment. And the real kicker is, it has to be severe enough that it actually gets in the way of your work or your social life. So once dementia is established, the next question is, what type is it? Because while Alzheimer's is by far the most common, look at this. It is definitely not the only game in town. You've got vascular dementia, frontotemporal dementia, and very often you see a mix of causes. This is why that detailed history is so critical for spotting the right pattern. Let's bring it all back to Mrs. E. Her doctor concludes that yes, she meets the criteria for dementia. The slow, gradual decline over 3 years, that's a classic Alzheimer's pattern. Now, she does have that vascular history, but her decline hasn't been stepwise. You know, where someone has a sudden drop in function, then a plateau, then another drop like going downstairs. Hers has been a slow, steady slope. So the final clinical diagnosis is Alzheimer's disease, with a nod to the fact that her past vascular issues could be a contributing factor. And this brings us right back to the role of that brain scan. For Mrs. E, a CT scan is ordered, but again, it's not to confirm the Alzheimer's. It's to get a better picture of any damage from her past vascular problems. It just helps the doctor understand that mixed part of her condition a little better so they can manage all her health risks going forward. And this really is the whole point. Every single step we just walked through is designed to get to this one simple truth. You can't start the right kind of therapy, the right kind of support, if you don't first have the right diagnosis. See, a diagnosis isn't an endpoint. It's really a starting line. It's the moment where all that uncertainty and fear can finally start to give way to a clear plan. It opens the door to the right support, the right treatments, and it allows families to face what's next with knowledge instead of just worry. The question shifts from what is it to, okay, what do we do now? And that changes everything.